Thank you and welcome to my poster presentation for NSC 892. The topic that I chose, or the problem that I see, is treatment for depression in the elderly. Alternative treatments is kind of what I'm focusing on, with the use of group activity through physical exercise. Depression affects nearly 7 million adults, older adults over the age of 65 in our population today, roughly about 35% of the elderly population. They do not seek treatment for various reasons. The reason that I'm focusing on are the side effects associated with the various antidepressants out there, ranging from drug interactions to just overall health concerns in taking these medications. Healthy People 2020, along with the CDC, have both indicated that treatment for depression in the elderly is a subject that needs to be looked at and monitored over the next few years. With the increasing population that we see with this age group, it is something that needs to be looked at. And exploring alternative treatments can give healthcare workers another avenue or another option to offer residents and people of this population, as well as it allows the older adult to have another option out there. A lot of these older populations and the baby boomers that's coming along are well educated, and they research methods, and medication is not always their first option. They're always looking for other ways that they can hopefully treat themselves without having to go down that pharmacological avenue. The method that I've chose to use in this is just basically a simple observational study comparing the results before and after the initiation of the intervention. The intervention chosen here is a 45-minute group activity done in a nursing home setting at this point. About 3 days a week, residents will attend these groups, which are already set up and already initiated in a facility. However, residents that participate in this program will be encouraged to attend, and attendance will be taken so I can monitor each one of their participations and their geriatric depression score. All of these residents will be alert and oriented as diagnosed by the mini mental status exam, and will be voluntarily initiated into this after explanation and everything has been explained and understood. Residents will be assessed in the beginning using the geriatric depression scale with a score of 10 or more indicating depression, and the objective of this study is to get that score down below 5, which indicates no symptoms of depression. Through the intervention, 3 days a week, 45 minutes a day, we hope to see a decrease of that geriatric depression score down below 5. To monitor this, we will be looking at it at 3 months, 6 months, and 12 months to see if there is a decrease. We again will be using the geriatric depression scale on the residents that continue to attend the group activity on a regular basis. We will be looking at those scores, gathering the information, and analysis again will be, are their scores dropping? Do we see a decrease in those geriatric depression scores to below 10 and hopefully to below 5? With the initiation of the proposed intervention, the attendance in the group with the 3 days a week, 45 minutes a day, we hope to see the most significant change in the depression symptoms. However, it has been noted in research as well that if we can decrease depression symptoms, we can see an increase in quality of life, which is the main reason that we want to decrease these depressive symptoms. Because with an increase in quality of life, we can also see an increase in life expectancy. And with our older population and all that they have given to society, I do believe it is our role and our importance to give them the best quality of life that they possibly can have. Thank you for your time.